How do mucus thinners help with CF airway clearance? Imagine trying to breathe through a thick, sticky cloud that clings to your airways. For people with cystic fibrosis, this is a daily reality because their mucus becomes abnormally thick and sticky. Mucus thinners, also called mucolytics, are medicines designed to make this mucus less viscous and easier to clear from the lungs. They work by targeting the physical properties of the mucus, helping to loosen it so it can be coughed out or moved by the cilia, the tiny hair-like structures in the airways. This process helps improve lung function and reduces the risk of infections caused by mucus buildup. One of the most commonly used mucus thinners is dornase alfa, also known as Pulmozyme. It is a specially engineered enzyme that breaks down DNA molecules present in the mucus. In cystic fibrosis, dead immune cells releases DNA into the mucus, making it thicker and more difficult to clear. Dornase alfa cuts this DNA into smaller pieces, reducing the mucus's stickiness and making it easier to cough up. It is inhaled directly into the lungs, which allows it to act right where the thick mucus is. Many people with cystic fibrosis find that dornase alfa significantly helps with airway clearance and breathing. Another helpful therapy is hypertonic saline, which is a salty solution inhaled into the lungs. The high salt concentration pulls water into the airway surface through osmosis. This extra water hydrates the mucus, making it thinner and less sticky. Hydrated mucus is easier for the cilia to move and for patients to cough out. Hypertonic saline can also help loosen mucus plugs and improve lung function over time. There are also classic mucolytics like N-acetylcysteine, or N-ac. N-ac works by breaking the disulfide bonds that crosslink mucin proteins in the mucus. These bonds give mucus its gel-like consistency, so breaking them makes the mucus less elastic and easier to clear. N-ac also has antioxidant properties that may help reduce inflammation in the airways. However, compared to dornase alfa, N-ac's effectiveness in cystic fibrosis is considered more limited, and it is used less frequently. Overall, mucus thinners are an important part of managing cystic fibrosis. They help reduce the thickness and stickiness of mucus, preventing blockages, lowering infection risk, and making breathing easier. These medications are usually combined with other treatments like airway clearance techniques, antibiotics, and medications that improve the function of the defective CFTR protein. It's important to remember that while mucus thinners improve mucus clearance, they do not cure cystic fibrosis or fully restore lung health. Their use should always be guided by healthcare professionals who can tailor treatment plans to each person's needs and monitor for any side effects. For example, N-ac should be avoided in people with certain stomach conditions, and dornase alfa should not be used if someone is allergic to its components. In summary, mucus thinners help by chemically or physically altering the mucus to make it less thick and sticky, which allows the lungs to clear out the mucus more effectively, ultimately supporting better breathing and reducing complications. Always consult your healthcare team to find the best treatment options for your individual situation.